This is the training video for the Op300.
First we'll go over the controls in general, and then we'll show you positioning on a patient. You're always going to start with your touch screen. You can select PAN, 3D, or CEF. We're going to select PAN for this video. Program 1 is your adult PAN. Program 2 is pedo. General rule of thumb is 8 years old, 80 pounds and under. Anyone older or heavier than that, we're going to go to adult. Program 3 is used for Class 2, Class 3 patients, or somebody that's had mandibular advancement or maxillary resectioning. Program 4 is going to help open those interproximals in the canine premolar region. You will lose your condyles, however. This is great for a patient that starts gagging with a PA of 10. Program 5, NFL lineman, 6'6", 350, huge jaw. Program 6, bilateral condyle. Program 7, posterior anterior condyle. Program 8 is your sinus image. And Program 9 is your extraoral bite wing. The bottom of the screen is always going to tell you what it wants you to do, and it'll also tell you when it's ready. Right now it's telling us to press the patient positioning button to rotate the unit to the patient in position. This is your patient positioning button. It looks like a bald man with 3 laser lines on his head. We'll go ahead and press that. And the machine will set itself up for taking a pan. We'll start close to the mirror and work our way out. The first 2 buttons are up and down arrows. They do what you would expect. They move the machine up and down. The next button looks like a light bulb that turns your laser lights on. With this machine we position with a center light down the center of a patient's face. That's going to go to the center of the philtrum, not the center of the nose. A Frankfurt plane light from the bottom of the eye socket to the top of the tragus, and a canine light for the maxillary canine. Those lights turn off every 35 seconds. The light bulb simply turns them back on. The bald man is our patient positioning button. The 2 arrows going in a circle when it comes to 2D is not going to be used. The next 2 buttons out that look like a bar with an up and down arrow, again, is for 3D only. The bottom 3 buttons are for adjusting your canine light. You do have a little blue tab on the left of the mirror for adjustment of the Frankfurt plane light. You have storage on both sides of the unit for bite sticks, bite stick barriers, etc. On the forehead support has an electronic lock. It stays in place. If you touch the white square on either side, it moves freely. You want to make sure that that starts as close to the mirror as possible before you put somebody's head in. The little black dial at the bottom tightens the temple supports and loosens them. You want to make sure that you have those as wide as possible before you place a patient. We're going to have a patient step in now, and we'll go through patient positioning. Have your patient step close to the unit and ask them to grab the handles. Place your left foot out in front of the patient and ask them to step forward until they hit it. What this does is this gets your collarbone close to the white bar here. Next, we're going to have the patient look straight ahead, and we're going to bring the chin rest down to the crease in their chin. I'm going to place my hand on the patient's back, ask her to lift her chin, pull into the unit, and set her chin down. I'm going to bring the chin rest down slightly to make her more comfortable. Ask her to open and close lightly on the bite stick. Her teeth will fall into the grooves. Next, we're going to ask our patient to look at herself in the mirror for the line down the center of her face and have her move so that that's down the center of the philtrum. Next, we'll use the blue tab to set the Frankfurt plane light on the bottom of the eye socket. I'm going to hold the back of her head and lower her chin till our light is at the top of her tragus, right here. So bottom of the eye socket to the top of the tragus. Next, we're going to have her smile so that we can see her maxillary canine. Right now that's just down the center, so we will leave the center button lit up. If it was distal to the canine, I would simply press the distal button once. If it was mesial, I would press the mesial button once. The light does not move, patient doesn't move, and machine doesn't move. We're simply telling a computer board which path to take. She's positioned, so we're going to go ahead and bring this forehead support till we touch her forehead. Tighten her temple supports. Ask her to close her lips, swallow and hold her tongue to the roof of her mouth, and we'll take our pan. Thank you very much. This has been your training on the OP300.